Hello, and welcome to part one of our adventure in exploring the inflammatory process together. We will be going through this in sections in order to make it more accessible and easy for you to be able to look information up again based on what it is you might have questions for. As we're going along, I invite you to answer along at the same time the questions in order to demonstrate your understanding of the inflammatory process. Now, one thing I do want to say before we get started is that the inflammatory process is a positive thing in our body. We often think of inflammation as being a negative thing, but in fact, it is what leads us to healing of cells once they've been damaged. And so it is a positive process that we have within our system. However, sometimes it can get out of hand in which inflammation actually becomes the issue. And when that happens, there are things that we can do to try and treat the inflammation. But starting off, we're going to walk through the process that is actually a positive process in our system in order to work towards healing. So, what are the hallmarks of injury? What is it that we will see universally as things are injured within our body? Well, if we look at the Latin roots of our words, we are looking at tumor. Tumor is when we have swelling in the area. We have edema. We have the collection of fluid that is occurring underneath the surface of the skin. We also have rubor, which is our redness that can come with that. Third, we have calor, which is the warmth that comes along with the swelling and the excess fluid that is building up underneath the skin. Dolor, which is the pain response that we can feel as an account of when we are injured in a body part. Sometimes this is when it's on palpation, when somebody's touching it. Sometimes it's on movement. And sometimes it's just when we are sitting there, we can actually feel that pain instigated. And lastly, we have functio laesa, which is the loss of function. So when we have pain and swelling in this area, it can ultimately lead to a loss of function of that body part. We lose that range of motion. We might be losing a little bit of strength, a little control over it, as the nerves might actually become compressed because of the inflammation. So all of these things that we see here are our hallmarks of injury. When we look through this process of going from tissue injury all the way down to healing, there are so many different things that are involved. Right? If we follow along the left side of the screen, we'll see that there is a release of many different chemicals. We're going to talk about these chemicals more in depth. I'm just giving you kind of an overarching introduction to what we're going to be talking about over the next set of videos. So, with that release of the cytokines or these chemicals that are all there, we'll see things like vasodilation to the arterioles, which can increase our blood flow, ultimately leading to the heat and the redness that we are experiencing as part of that hallmark of injury, right? That in turn will actually end up increasing the temperature and the metabolic rate of the cells. So it is in the process towards healing, right? So the idea is these things and these hallmark symptoms that are coming when we are injured are actually steps along the way toward healing. It is normal healing during these processes. When we increase our capillary permeability and we get that leaking of fluid that starts to come through, there's a lot of different things that are leaking through in that time period, which can lead to the pain and the swelling that we experience, which then can lead to that loss of function. Right? Throughout this process, though, we're also leaking things that can help us towards healing. Same things with our white blood cells being called to the area in order to actually leak out from the bloodstream into the dermis, right? And then it can end up consuming all of these dead tissues as well as the excess chemical mediators to clear everything of debris and lead towards healing. So as again, just looking at this overall picture, moving from tissue injury to healing, we will have these hallmarks of injury, but they are leading us towards the steps of healing. So I'm going to show you a little bit of video throughout this time period. We will have some videos that we will look at that I pulled from other resources that I thought were really good at just demonstrating it. So to get us started, we're just going to start with a basic overview of what we're looking at. And again, we will be going more in depth as we go throughout this series.
The inflammatory response is an important nonspecific defense against tissue damage. It begins when injured tissue cells release chemical signals that activate the endothelial cells of nearby capillaries. Within the capillaries, adhesion molecules called selectins are displayed on the activated endothelial cells. These adhesion molecules attract neutrophils, slow them down, and cause the neutrophils to roll along the endothelium. As the neutrophils roll along the endothelium, they encounter chemicals that activate integrins, which are adhesion receptors on their surfaces. These integrins then tightly attach to adhesion receptor molecules on the endothelial cells. This causes the neutrophils to stick to the endothelium and stop rolling. This accumulation of neutrophils along the walls of the capillary is referred to as margination. The inflammatory mediators released by the injured tissue bring about changes in the environment that cause mast cells to degranulate and release histamine. Histamine causes vasodilation and an opening of the junctions between the endothelial cells, allowing fluid and leukocytes to leave the capillary and enter the infected tissue. The neutrophils now undergo dramatic changes in shape and squeeze through the endothelial wall into the interstitial tissue fluid. This process is called extravasation. The neutrophils, followed by other types of phagocytes, are attracted to the damaged site by chemotactic substances released by bacteria and tissue breakdown products. They ingest and destroy invading bacteria.
All right, so after looking at that, I just want to now introduce you, and we'll go through these, to all of the characters that are involved within the inflammatory process. So we will be starting off by looking at the blood vessels and just what part they play, how do they function, what's the anatomy of them. We will look into some specialized cells as well and looking at the details of what role they play in this inflammatory process. So these are cells like the natural killer cells, mast cells, macrophages, endothelial cells, and white blood cells. And a lot of these we just saw in that previous video. We also have an abundance of chemical mediators that are involved. So we'll walk through what are these chemical mediators, also known as cytokines, and what role do they play, what do they activate, what releases them, and go into those details as we go throughout this series. And then we also will talk about the lymph system and how do we clean everything up after the fact, after we have seen the healing, and how do we get rid of all of these broken and damaged cells as well as excess chemical mediators. Okay, so just looking at the layout of what happens. So here we've got our skin, and there is damage to the skin somehow. It can be a wound, it could just be an injury, right, of what's happening. A lot of the things that we look at as far as pictures and diagrams and videos that we see on inflammation all start with some kind of a wound, which often is something coming from the outside into the inside and introducing like a toxin or bacteria to it. However, I do want you to realize that this can happen even with like a sprained ankle or a strain in a muscle. All of those different events can also instigate this inflammatory response. So we have some kind of a damage to the area. Any bleeding that is happening, if there is bleeding in the area, the blood platelets will help us to be able to clot, right? Then what we have is an activation of mast cells. Mast cells are the ones that are going to release some chemicals called histamines, as well as other things, in order to start sending messages to our endothelial cells. The endothelial cells are the cells that line the blood vessel. So messages are sent now, and we have white blood cells, monocytes and neutrophils that are traveling in the bloodstream that are now congregating and being pulled to this area because of these chemical mediators. When we have this vasodilation, this opening up and this gap that occurs within the endothelial lining, these white blood cells can actually escape out. It's called diapedesis into the dermal layer. These neutrophils and monocytes actually will start to morph into eating cells that will consume all of the tissue that is injured in the area. So those can be a combination of neutrophils and macrophages that are all happening and consuming all of the dead tissues. They are also releasing a whole bunch of cytokines, or those chemical mediators, to help basically propagate this and keep the inflammatory response building. So it is a positive feedback loop in which it is activating and activating and activating and continues activating until it can actually initiate the tissue repair. Once all damage has been repaired, then it can actually stop that inflammatory response and it can go back to a resting level. So that's kind of just the layout. It's a broad sense. We are going to go into more details as we go throughout our series. So we're going to start out first with our blood vessels and learn a little bit more about the anatomy behind them and how they work and the difference between our artery veins and also our capillaries.
If we take a closer look at blood vessels, they have three layers, also called tunics, or coverings, that surround the vessel lumen, which is the hollow part of the vessel that holds the blood. The innermost tunic is called the tunica intima, which includes the endothelial cells, which creates a slick surface that minimizes friction for blood moving through it. Next, there's the tunica media, or middle tunic, which is mostly made of smooth muscle cells and sheets of elastin protein. Both the cells of the tunica intima and tunica media generally get the nutrients they need from the blood in the lumen. Finally, there's the tunica externa, or outside tunic, which is made up of loosely woven fibers of collagen protein that protect and reinforce the blood vessel and anchor it in place. The tunica externa also has nerve fibers, lymphatic vessels, and, in the biggest vessels, the protein elastin. To make things really wild, some huge vessels have a tunica externa that's so thick that it needs its own blood supply. So the largest arteries closest to the heart, which are the aorta, its main branches, and the pulmonary arteries, have so much elastin in their tunica externa and tunica media that they're called elastic arteries. These guys are really stretchy, kind of like spandex. And this is what allows these arteries to keep their shape as well as absorb and even out the systolic and diastolic pressures. These arteries eventually branch into the arterioles, the smallest of the arteries. In the arterioles, the tunica media is bulky and can contract in response to hormones in the autonomic nervous system, which is called vasoconstriction, where the lumen gets a lot smaller, which decreases the blood to a capillary bed and ultimately the organ or tissue it supplies. Also, though, these vessels can relax or vasodilate, and the lumen's diameter increases, which allows more blood flow. This process can also help with temperature control or thermoregulation, because blood carries a lot of heat with it, and when it gets close to the surface of the skin, more of that heat gets lost. So with vasodilation of the arterioles, more heat gets lost, which therefore helps to lower body temperature. Likewise, if you wanted to raise body temperature, vasoconstriction reduces blood flow, which means less heat gets lost through the surface of the skin. Finally, the capillary walls are generally only one cell thick, just the tunica intima layer, with some larger vessels that also have a subendothelium basement membrane layer, which is a layer of protein just outside of the endothelial cells that provides extra support. In addition to allowing oxygen and carbon dioxide to flow back and forth, capillaries are also where nutrients like glucose can get delivered, and where fluid can move out of the blood vessel and into the interstitial space, which is the space between the blood vessels and cells. Water-soluble substances, like ions, cross the capillary wall through either water-filled spaces, called clefts, between the endothelial cells, or through large pores in the walls of fenestrated capillaries. Meanwhile, lipid or fat soluble molecules like oxygen and carbon dioxide can dissolve and then diffuse across the endothelial cell membranes. On the other end of the capillary bed, there's a venule. And the arteriole and venule are usually directly connected by a vessel called the medarteriole.
Excellent. Well, this concludes our first lesson in the inflammatory process. Next lesson, we will come back and we will start talking about some of these specialized cells. Make sure that you have completed all of the questions on the assignment down below, and you can review any of them before you officially submit